Laparoscopic gastric bypass, or the lap band, is the commonest weight loss operation in Australia. We are the lap band capital of the world. It's certainly the simplest and it's certainly the safest. It's an overnight stay in hospital with keyhole surgery, and we put a band around the top of your stomach to create a little pouch. The band's attached to a port that sits underneath your skin. I put it just underneath your breastbone. You go home the next day, and then at 3 weeks you come back and you start to have the band adjusted. It takes on average about 5 adjustments to get the band set to you as an individual, and that usually takes about 9 months. You have to be quite strict with your diet with the band. You have to chew your food well, eat slowly, otherwise you run into problems. The current mantra is 20-20-20, so that's 20 chews before you swallow, 20 seconds between swallows, and you're all done in 20 minutes. If you can follow that regime, you can expect to lose 40 to 50% of your excess weight over the next year to 18 months. It's becoming less common now because of the issue with complications and reoperations. Depending on the papers that you study, the reoperation rate for bands is between 25 to 45%. That varies from minor issues to do with the port to major issues to do with the band. The younger you are when you have a band, the more likely it is you're going to need further surgery, simply because it's been there a longer point of time. It is irreversible, whereas the other operations that we perform are not irreversible. So if you want the safest operation, it has to be a gastric band. Complications include band slip, which is about 5%, which requires further surgery to correct, band erosion, which is less than 1%, and then port problems such as the port flipping over or the port getting infected. So certainly at the moment, the lap band's not my favourite operation, and I think it's going to become less common as time goes on due to the ongoing issues of reoperation and band complications. But for younger people who don't want something that's irreversible, or people who want to have an operation that can be reversed, then it's certainly something to consider. Have a look at our information booklets, and feel free to come up and have a chat.